Hi everyone, my name is Milkie Vu and I am at Emory University. So in this presentation, I hope to do two things. The first is to talk about a systematic review that we recently completed on determinants of HPV vaccination among Asian Americans. And then I want to talk about one of our projects that partly built on the results of this systematic review, but specifically looking at HPV vaccination among US Vietnamese. And for both projects, it used the P3 model, as you can see on the right side of the slide, as the guiding framework. And this is a model that assesses practice, provider, and patient level determinants of preventive behaviors, such as HPV vaccine acceptance and uptake. So to start with, this is a systematic review that we published in 2020. And the motivation behind this study was because we look at data from several nationally representative surveys and found low HPV vaccine uptake among Asian adolescents and adults. And we were interested in understanding facilitators of and barriers to HPV vaccination in this population. Now, I believe this article is listed as a part of the pre-reading. So just for the sake of time, I'm going to summarize some of the key findings. So 26 articles were included in this review, and the ethnic groups most commonly studied include Koreans, Chinese, and Cambodians. And one thing that we note was the variability in terms of report vaccine intention, initiation, and completion prevalence. And this goes to show the heterogeneity in Asian communities and across studies, and also highlights the need for disaggregated data by Asian subgroups to understand possible disparities in health behaviors and outcomes. Now, we found that only 3 studies measure practice level determinants of HPV vaccination. And practice level determinants include the availability of multilingual services at the clinic, as well as insurance policy regarding reimbursement for HPV vaccination. And in addition, we've found 12 studies that measure provider level determinants, and all of them assess the communication between providers and patients or parents. However, a shortcoming of the existing literature is that these studies have only assessed the presence or absence of patient-provider communication about the HPV vaccine, but none of them actually measure the content of the HPV vaccine recommendation or discussion. Now, at the patient level, and again here, just for the sake of time, I'm presenting the determinants most commonly noted across studies. Now, those include vaccine knowledge, perceived safety or side effects, perceived susceptibility, beliefs about the relationship between vaccination and sexual activity, perceived costs, and motivation to get protection from disease. And these can be relevant targets for interventions or education programs to improve HPV vaccination coverage in Asian communities. So now I want to talk about a project we recently concluded that built on some of the findings from the systematic review. And we were motivated partly due to the fact that, as you can see in the review, very little research has looked at practice level measurements or assessed the content of providers' HPV vaccine recommendation. So we conduct a mixed method study with US Vietnamese parents and assess the P3 factors influencing their decision-making about HPV vaccination for their adolescent children. So just some preliminary findings from the surveys and interviews. We found a desire from parents to have clinic-based materials about the HPV vaccine in Vietnamese. And this is because parents know that even when they might be fluent in spoken English, parents will still encounter troubles with understanding medical terminology in English. And in addition, there is a need for reminder systems of HPV vaccine appointments, especially for those who had initiated but not complete the vaccine series. And in addition, we found that provider recommendation, especially a high quality recommendation that emphasized same-day vaccination or the cancer prevention values of the HPV vaccine, positively impact HPV vaccine intention and uptake. And parents who discuss trust in providers also more likely to accept vaccination. Now, for patient level findings, One interesting result was that because of the way the HPV vaccine is often translated in Vietnamese, parents thought that it's only for cervical cancer prevention, and thus only females should get the vaccine. So altogether, these findings show the different barriers to HPV vaccination that should be addressed in future interventions at the healthcare practice, provider, and patient level for US Vietnamese in particular, but possibly also other Asian or immigrant populations for whom English is not a native language. So I would like to acknowledge the different funders that support this study. Thank you so much for attending this presentation, and do not hesitate to contact me with any questions. I'm happy to talk.